research quite the same time as well.
Thanks, Lena. And I am Orkan Okan from Bielefeld University in Germany. I'm a former teacher, now researcher at the Faculty of Educational Science here. My focus research area is health literacy, health promotion and prevention in children and adolescents. And here at the university, I'm doing a lot of teaching in relation to teacher training, but also to other topics like health communication, health promotion, etc. And today with Lena, we are very glad that she invited us to take part in this 3-day academy. And we are going to talk a bit about health literacy in schools today. We will do the presentation together. We have equally shared the time and the slides, and I will just show you the agenda for today. So we'll talk a bit about the topic of health literacy. This morning we learned a lot about school health promotion and about the many subjects that you all address in relation to school health. Then we will talk a bit about health literacy in schools. This part of the presentation is mainly informed by the SHE fact sheet on health literacy that was just published this year. And we'll go on to explain why schools are so important, introduce different health and education perspectives, also some evidence today, and then introduce some important dimensions and perspectives that needs to be considered when bringing this topic to schools. And after our presentation, there will be enough time to have discussion, interaction with you, question and answer. We will keep track of the chat box to see what kind of questions pop up, and then we will try to address them as good as possible. So we'll start a bit with a history about health literacy. What is health literacy and where health literacy does come from? And since to many of you and also to many of us working in the field, health literacy is a relatively new concept. You can see here that actually it was first introduced in the 1970s in the area of education and schools, and it was defined as a learning outcome to school health education in the United States. But for many years, you see almost 2 decades, not much has happened on health literacy, neither in research policy or practice. At least you cannot find anything except one article from 1984 published on the topic. And it was in the 1990s when in the United States they did a literacy survey, adult literacy survey, also in relation to health, and they found out that almost 90% of the American citizens had low literacy skills, and people in the healthcare sector began asking questions like, what does that mean for healthcare, for health promotion and prevention? And so health literacy was rediscovered in the healthcare sector with a focus on patients and a narrow concept of health literacy addressing functional health literacy, meaning reading, writing, mathematical, arithmetic skills and understanding in relation to health terms in the health interaction. So mainly patient skills and patient competencies to treat themselves and adequately take part in management and self-management and treatment in relation to healthcare. By the same time, in 1995, the education sector in the United States defined their new curriculum on health literacy as a central learning outcome in schools, and also provided the oldest known definition of health literacy nowadays. But then again, for a long time, nothing happens before public health discovered the concept, the WHO mainly, and included it to their health promotion approach. Many of you are familiar with the Ottawa Charter, with health promotion, and then health literacy was added as an important concept. And so like in the 2000s, 2005, 2006, research began to address children's health literacy. And this is where Lena and I come in with our research. So you see, there's a span of 30 years when it was first introduced in the education sector until it was rediscovered there. Today, there are more than 250 concepts and models and definitions on general health literacy, and even about 40 addressing children and adolescents, and the amount is still increasing. And the WHO definition describes health literacy as the skills that determine the ability of a person to gain access to understand and use health information. And in 2012, a very similar definition was presented, updating the earlier definition by WHO a bit by adding also evaluation of information as an important dimension, which of course you can see today with online information, all what's going on in the internet, social media is important, and even much more important since COVID-19. This is one way to conceptualize health literacy. Another way is to put health literacy in a three-tier concept based on functional literacy, which are the basic skills, interactive health literacy, which is more about social skills and communication, and critical health literacy, which is much about evaluating information and also addressing the determinants of health. But you don't understand this concept as a hierarchical construct, but more like a circle. You don't need the one competence area to access or reach the other competence area. So here is a sum up of what health literacy can mean. First and foremost, it's a dynamic construct. It depends on the content and also on the context. It's a relational context. It somehow contributes to self-efficacy. And by self-efficacy, people become more confident to take part in health communication. So it's also about handling information competencies, navigating an information environment. And this altogether leads to greater autonomy and empowerment. You see the basic constructs that are within the core definition of health promotion. Regarding health equity and health inequalities, health literacy has known to be a mediator between the socioeconomic status of a person and to mitigate the effects that on the health inequalities area. And some also say that health literacy is a determinant of health, and others say that health literacy needs to be embedded into a political approach. And when we look on why health literacy is so important, we can see that low health literacy is associated with lots of different negative health outcomes. For example, lesser health knowledge, unhealthier behaviors, lack of engagement with healthcare providers, even higher mortality rates, higher healthcare costs, and increased hospitalization, etc. So there are lots of systematic reviews and meta-analysis on that for further reading. I just put some references below there. And more important than what health literacy is should be the question on what health literacy can enable a child to do. And here you see an extraction from the SHE fact sheet on health literacy. Actually, it's a couple of bullet points that we summarize there. What a child and adolescents can do with health literacy. And I don't want to go through all of these. You can read them in the SHE fact sheet, but you can see that there are a lot of places where health literacy can be used. And when we talk about health literacy, of course, we talk about competencies, an individual construct, but in fact, what's going on with structural health promotion and prevention, we know that the conditions within the environment itself, so the system level, counts. And therefore, there is this relational understanding of health literacy, which on the one hand says, there are the student abilities. We are now putting this to the school sector. There are the abilities, the health literacy competencies, and they meet the competencies of the education sector, the complexities, and both has to be addressed in order to increase health literacy and reach good health outcomes. And this is a model that was presented in 2006, 2011, and finally was adapted by Sørensen last year. And we have just adapted it to schools and put in their education and schools. And here is also how you can differentiate between personal health literacy and organizational health literacy. Whereas personal health literacy is the definition that I have just introduced you to. The definition for organizational health literacy is this. This is a general definition for healthcare sectors. And here is a try to adapt this to schools, for example, meaning that organizational health literacy in the education sector is the degree to which schools equitably enable students to learn the competencies to access, understand, appraise, and apply health information in order to make judgments and take decisions in the lifespan. Health literacy has been a core topic in this year's SHE fact sheet. But other than that, there are lots of reports, publications, also from within SHE and the WHO or the International School Health Network, reflecting on health literacy in a school setting. You can access these publications, some of which are on the homepage of SHIS, others on the WHO homepage, and others I'm sure you will find when you search for them on Google. So in the SHE fact sheet, we have collected some of the evidence and developed a model how health literacy is impacting on health outcomes and how health outcomes impact on education outcomes and how this is all related. And when you attended the meeting this morning, when Kevin talked about the Vilnius conference, how health could impact education and why this is so important dimension, a factor to consider, then you see we have health literacy here in the middle, and it is it influences the attitudes or the health behaviors, and we listed a couple there. These together have an impact on the health status of students, and the health status impacts educational outcomes, both in short and midterm and also in the long term. And this indirectly, again, addresses the health status, the behavior, and also has an impact on health literacy. So we can see that indirectly health literacy can have an effect on educational outcomes, which is why it should be important. But in the sense of the relational concept and the system level approach, we know that there are determinants that influence if and how children can acquire the competencies necessary and also influence health literacy on the organizational level, and they all have to be taken into account. And Lena will talk a little bit more about evidence today and also in the keynote tomorrow. We know in the sense of the organizational and relational approach that it's not only about the health literacy of students, but the teachers and the principals, they have a critical role to play. For example, already in 2001, Peterson and colleagues from Australia, one of the very first publications on health literacy in children, defines that the teacher health literacy is as much as important as children's and school children's health literacy, and it is the counterpart to students' health literacy, because when students want to learn about health literacy, they need health literate teachers who are familiar with the concept and able to teach about it. And in another study, we learned that principals' health literacy is related to the amount and the degree of health promotion activities in schools. And here in Germany, principals are on the most important persons to address when you want to bring health into schools, and you need that. And the other important issue, especially these days, is digitalization and digital change. So health literacy has a focus on online and internet and social media information, and therefore this needs to be brought into schools. Schools need infrastructure, digital communication technology as part of the instruction, didactics, and content in the classroom to make children familiarized, not only to learn the competencies necessary for health literacy, but learning all the surroundings, factors, attitudes whatsoever, and also practice it using the internet. And therefore, we need this topic in schools, not only in the when children do in their leisure or spare time use their smartphones or the computers to access to the internet. It needs to be a critical item on the curriculum in schools. And this means that the school infrastructure needs to be addressed, because not all schools are equipped for the 21st century digital age. There are schools that have teachers who are educated in digital literacy and education. They have computers, they have internet, they have Wi-Fi access, etc. They even have a digital library, but there are many schools who cannot participate in this. And so it is very important, if we want to bring health literacy in schools, to also make this an important issue, which should be supported by policy with funding, and not a one-time funding, but a sustainable funding over the years. And another important issue when we talk about digitalization and also the COVID-19 pandemic is the infodemic. Infodemic is the short for information epidemic, meaning that, for example, the COVID pandemic is accompanied by an overabundance of information. So you have the disease spreading on the one hand, and parallelly information. It can be right information, can be fake news, conspiracy theories, whatsoever. they spread even faster than the virus. And this is an issue why health literacy is important, because people, and especially children and adolescents and their surroundings like teachers and parents, they are confronted with an overwhelming information environment, and they need the skills to decide whether the source is good, you can trust the source, or if there is fake news behind that. So in the fact sheet, we also talk about health literacy in the school directly. So one opportunity is to have a curriculum on health literacy, like, for example, Finland has one. But you can also try adding health literacy if you're from a country where there is no health education or health literacy curriculum, to add to the curriculum where there are similar concepts in place, for example, digital literacy or media literacy. And when you apply them to the health context, you pretty much have health literacy. And we heard a lot about school health promotion and health promoting schools. And of course, this is what we need, a whole of school approach when we want to address health literacy. And here you see the European standards and indicators for health promoting schools that have been published last year by SHE, and they highlight health literacy on several of their dimensions, which is very important to know. And here you see the input, process, and outcome model of the different standards and the different processes related to the health promoting schools. And in one of them, standard 7, health literacy is also defined as an important indicator on the classroom level, but also on the systems level. And in the SHE fact sheet, we tried to use this knowledge to develop a model combining the health promoting schools and also the organizational health literacy approach, which you can see here in the middle. You see these are the dimensions of the organizational health literacy, and here in 1, 2, 3, and here the green ones, empowerment, equity, and participation, are taken from the health promoting school approach. This is a project that we are currently doing in Germany, funded by our health ministry, called Health Literate Schools, where we exactly do what you see here, talking to teachers, talking to experts, having workshops, doing literature analysis, and also some preliminary testing in order to develop an approach here for Germany that combines both these approaches, aiming at developing a concept, a questionnaire, and also a guidance document. And this is ongoing work. You can read more about this in the SHE fact sheet. And at this point, I came to the end of my slides, and I will now turn over to Lena and mute my mic. And then Lena will tell me when to switch the slides.
Yes, thank you a lot. Yes, indeed, there are different perspectives for why health literacy should be developed in schools, and Orkan has brought up several of those. I will go back to some of these and will put a special emphasis on health, education, and ethics. I will argue that any attempts to promote health literacy among adolescents should be grounded in sound ethical reasoning. And one of the justifications relates to evidence showing that better health is linked with better health outcomes. And as the protection of health of the public is an inherently moral one, developing health literacy among the children and the public more generally is a moral act. And the next slide, please. And we could also say that better health literacy is also linked with the adoption of health protective behaviors that are particularly topical now during the pandemic. COVID-19 clearly showed that health literacy is needed to make rapid changes in daily habits to decrease the spread of the virus. Here also, the access to valid information is crucial. However, handling of extensive amount of information on coronavirus with a variety in quality calls for complex health literacy skills that people should master. Abilities to think critically and to find reliable information on coronavirus secures genuine access to and power over the knowledge and knowing. That is, ability to interpret, evaluate, and act on it. However, for instance, among adolescents, we know that every fourth has difficulties in assessing the credibility of the health information and comparing the information gained from the different sources. And every fifth have difficulties in finding the health-related information that is easy for them to understand. Furthermore, the differences between the countries are clear. When, for instance, around 30% of the adolescents in Germany report difficulties in assessing if health information is right or wrong, the corresponding figure in Finland is around 14%. Next slide, please. Health could also be seen as a value, and hence various efforts to focus on the factors promoting health could be seen as justified, including the development of health literacy. And seeing health as a value is in line with the argument made by Sen in 2002 that health is among the most important conditions of human life and a critically significant constituent of human capabilities, which we have reason to value. And any deprivation in people's health harms their capability for health functioning and agency, whereas improvement in health promotes and maintains relevant capability and human capital. Conversely, human capabilities may increase good health or a part of the opportunities to do so, enabling individual freedom to choose certain levels of functioning, like to eat healthily. Health literacy could be seen as a capability that enables individuals to enjoy freedom, and this view is closely related to empowerment as an ethical principle of health promotion. And health literacy often considered as a critical factor in empowerment, as it enables greater independence in taking care of one's health and thereby supports autonomy and freedom. From this standpoint, health literacy per se could be seen as everyone's right, including children's. And the next slide, please. So when we are talking about children, we cannot overlook the role of educational system in developing health literacy. And according to UNESCO, one of the main purposes of education is to reduce inequalities. And acquiring health literacy skills at school could decrease health inequalities between children from, for instance, different socioeconomic backgrounds. However, according to UNESCO, the gap in learning outcomes between rich and poor within and between countries is high and often growing. And unequal investments in children and their health is one of the main causes for health disparities within and across countries. Schools differ in resources, and their capabilities to react in new demands vary. This leads to a situation that pupils do not have equal chances to learn all currently needed skills. If health literacy is part of the curriculum only in some countries, states, or schools, the unequal chances for pupils to learn health competencies may well increase the gap between pupils with low and high levels of health literacy. And here is a paradox. If health literacy contributes to better health outcomes, then education with different content and quality may paradoxically promote health inequalities. But since education does promote individual health and well-being and can contribute to greater empowerment within society, it could also be argued that developing health literacy through educational practice in all schools is inevitably good. It has been found out that schooling reduces cognitive inequalities across socioeconomic status and compensates for limited learning experiences outside school, whereas these different environments outside school, like family, friends, and neighborhood, appear to influence widening cognitive gaps between various groups of children. And all of these reflections have influenced on the discussion about whose health literacy should be developed, and every people or only those with lower health literacy. Go on, Orkan. So some favor targeted interventions to those most in need and ask if it's fair to educate pupils who already have high levels of health literacy if education does widen the gap. But some favor universal approaches, and some combined of these two, that is universal plus targeted, which would then follow the principle of proportionate universalism. And it would then take into account that as education in general is everyone's right, so is education on health issues. but recognizes as well that with a special focus on those in need can yield positive outcomes that benefit everyone in society, along with narrowing the gap in health outcomes among and within various population groups. Next slide, please. But ethics is also embedded on the selection of the health literacy competencies in schools, and I will give 3 examples of these. First, the development of various critical thinking skills enables an access to valid information, like Åkun said, and hinders of leaving the power over knowledge and knowing in the hands of few. 2, abilities to reflect one's own wishes, preferences, values, and attitudes in health issues and life in general support adolescents to find their own voice, their autonomy. Together with critical thinking skills, self-awareness supports freedom from passive following of traditions. And 3, developing skills that support adolescents to participate in making decisions that concern their lives relates to children's right to be respected, heard, and involved. They are treated as citizens in their own right. But here also important question is, when does health literacy end? Who decides what are better ways of behaving than the others? And is it person's responsibility to behave in a healthy manner? What if people choose differently after a critical reflective process? And do all the people have equal chances to make healthy choices? And how is the role of environment in influencing behaviors taken into account when defining the competencies that should be covered in the definition of health literacy? Next slide, please. So in the context of education, important is also if the central aspects for the competence to be seen as a key competence to be targeted in schools will be covered as OECD has defined a key competence. And we could say that yes, health literacy could be seen as a key competence as it does contribute to valued outcomes for societies and individuals. And for individuals, for instance, health participation, freedom and empowerment, and Åkun listed several societal benefits that improved health literacy could contribute to. And it does help individuals meet important demands in a wide variety of contexts. And yes, it is important not just for specialists, but for all individuals. And next slide, please. So to conclude our first keynote, it could be argued that in Europe, but also globally, schools have the potential to be the single most important setting in which to develop health literacy in the current and future generation. There are, however, few important perspectives that should be guaranteed. And the first one is an access to education. Currently, striking inequalities exist in education provision across the different regions of the world. When in 2016, 2.1% of lower secondary age children in Europe and North America were out of school, the corresponding figure in sub-Saharan Africa was 36.6%. So access to education offers children the possibility to participate in all school-based health literacy learning that takes place in their school. And the second one is access to age-appropriate school health education through a whole school approach and school curriculum. So only few countries have embedded health literacy into schools' policies and practices. But if included into a national school curriculum, that could minimize health literacy differences within countries. And if included into national curricula of all countries, that could minimize the differences between countries globally. And third one is that opportunities for all children to develop the highest levels of health literacy. So no child should be expected to learn or know less than any other. All children should be able to pursue their full potential regardless of who they are and where they live. Other paths to achieving that goal might be fairly different. And the final slide, please. And fourth perspective is that opportunities to develop lifelong learning skills should be offered. As health literacy is a dynamic phenomenon, the development of health literacy skills to meet the changing demands requires equitable access to lifelong learning. And fifth, access to free exchange of health information and valid information technology is crucial, like Orkan said. Schools differ in resources, which may cause unequal chances for pupils to learn all currently needed skills, and also deepen the health literacy differences between the pupils. So the equal and adequate distribution of the resources is essential. So thank you.
Thank you so much, Lena and Orkan. Just make sure that I haven't misunderstood. So the presentation is over now, and we have time for questions now, or do you coming back, Orkan, to say more, or we are ready now for questions?
Right, I think that we can now go into the discussion.
Yes. Orkan, can you, if you stop share your screen, I think it's, yes, so that's easier. So we are all here. Well, I have two suggestions, and Orkan and Lena, I will let you decide what you prefer. I mean, we can maybe just give ourselves a 2 or 3 minute break to see if, and let people ask questions in the chat function, because we are now 66 people. That's a lot of people to you know, to share in a discussion. So could that be a way to, or that would be my suggestion anyway. Would that be okay with you if we do it this way?
Yep.
Okay, so you know, you don't have to leave your computer or turn your camera off. Don't feel that you have to ask a question, but yeah, please say if we can give a few questions that you think that you would like Lena and Orkan to answer, or points you think would be good for a discussion. We'll just leave it for a couple of minutes, and then we will, Orkan and Lena, you can be the ones to pick the ones you think would make most sense.
Hello, could I ask a question? Or
Yes,
That's
please.
a good idea, Linda. Please ask the question, and then we can write questions while you are asking. Thank you, Linda.
okay. One of the questions I had, thank you first of all to both of you, Orkan and Lena, for your excellent presentation, which to me, again, goes to help all of us to get a better sense of what health literacy is meant and the potential that exists within the school system. One of the things that I ask myself often is, how is it that the schools can work closer to the health system itself? Because I live in northern Italy, in Piedmont, and from having lived in Tuscany, this connection basically does not exist. Yet it does exist in other parts of the world. I lived in Boston and Massachusetts. There we had the Cambridge Health Alliance. Some of you may know about it, but an excellent organization that even had a Department of Community Affairs. And so we worked together, health system and schools, and it was a beautiful result. We would organize fairs to do outreach with certain communities. I'm a Latina, and so I would try to organize fairs for the Latino community and, you know, the health issues that were happening there. And eventually, one of my colleagues was able to actually convince various key players so that there could be a health clinic inside one of the high schools. And as time has gone by, and now living here in Italy, I realized what a revolutionary idea that was. Here, we don't even have a nurse inside our schools. I mean, that's how far, to me, that's sorry, but that's how far behind we are in my own context. I mean, a nurse doesn't seem to be asking for much, no? But there are no health lessons. And so it's, in our case, it's a very uphill road. But anyways, I'm just throwing that out there because I was curious to hear if other countries have something like what, you know, exists in Boston, Cambridge, Massachusetts. Thank you.
I don't know if you have a comment, or Lena or Orkan for Linda's comment, or
I think the question was really good, and I think that all of us from different countries could contribute and give their examples how healthcare system is embedded or not into the school system, and that's one of the key pillars of health promoting school concept. And at least in Finland, school health services, and it's closely linked to school curriculum. Actually, it's embedded in the same system and all these pupil welfare systems. So school nurses, school psychology, and different kind of stakeholders work together in the same system. And depending on for instance, if there is some problem or some challenge at hand, they form a kind of joint group where they solve this problem that is current or topical at the moment. And depending on the problem, different kinds of stakeholders are involved in this group, this well-being group. And that's the case, at least in Finland.
Yeah, I also like the question very much, and I believe it is very important in the sense of the whole school approach, where intersectoral collaboration and networking between schools and other sectors and partners, and in this case, health is very important. But in Germany, like in Italy, there is no such link, at least no mandatory, and there are a couple of model projects in 2 different states among the 16 federal states here in Germany. It's only a model project. They're testing it to bring in some school nurses into some selected schools and keep track of their experiences and evaluate the programs. Very small scale, but also very interesting. This is one thing. And it's very important in the sense of the whole school approach. The other thing is that having the health sector collaborating with schools, in schools, for example, through health nurses or other health professionals, psychologists or whatsoever, should not relieve the school, the teachers and the principals from their duties also to engage with health. So there are certain things that health and medical professionals can do in schools when it comes to medicine, the core health topics, the subject, but many of the things that we have shown in our presentation, where it's about identity development, self-development, self-awareness, acquiring competencies, the core health literacy values, etc. This is where the school has an important role to play. And maybe if health can be understood as a cross-cutting topic on the classroom level, and also on the system level, the organizational level on the school, where people from different professional backgrounds collaborate, I think this could be a very promising approach. But then again, you need the foundation for that, the fabric, and first have health education as a topic in school, and then the intersectoral approach by networking with health professionals, and then health literacy. So many bricks needs to be addressed in order to get this going.
Yes, thank you. I would like to, Katarina, your question, to take that, and maybe please, or maybe it's better that you ask the question, Katarina, please. You were writing about what Kevin was saying, the lack of sustainability, focus on that, and now this whole argument that it's a good idea. Could you ask your questions and maybe Lena or Orkan, or other people also could, of course. Yeah.
Yeah, thank you very much. From the talk of Kevin, I remember that there is a lack in sustainability. He said when the school budget or the support, the financial support is over, so the program is left behind, and so health literacy is lost, and there is no ongoing process. And at the same time, we all know, and Lena and Orkan nicely highlighted, that the whole school approach is one or maybe the most beneficial way forward to health literacy and empowerment for health orientated sustainable action readiness for the kids. And we know it tracks over time to adulthood when we get parents and multipliers in policy making and teachers, in physicians, etc. So to me, this is a misery, and I was wondering how we can solve this misery. And at the same time, we have the state mandate in the curricula, for example, in Austria, and also at the same time, we have a lack of evidence. So maybe Kevin and Lena and Orkan can answer a bit of this, how we can bridge this gap, because to me, it's a major gap and abyss we have to focus in the next years in research. Did you hear me or not?
Yes, absolutely.
It was a lot of information. Can you put your question in one sentence, and then we will try to answer it?
Okay, there is a gap between the sustainability of the whole school approach in health literacy and health education, and what you highlighted as benefits from the health literacy benefits from the whole school approach. So dot now, and maybe you can answer first part of my question.
So you are, just that I understand you correctly. So you ask for the sustainability of health promotion in schools and how health literacy could contribute for schools in relation to school health be more sustainable, right?
Yes.
Okay, Lena, should I first and then you, or? Okay, so it's a very, very complex and also difficult question. First of all, in relation to health literacy, we have to admit there is no evidence or almost no evidence whatsoever what the benefit of health literacy could be for health promoting schools, although it is obvious. Lena perfectly described why schools are the most important settings to enhance health literacy early on in the life course. But this is the school. This is not necessarily the health promoting school. This you can do in the school through health education or digital education or media education or information literacy, whatsoever, what you need. But since one of the standards or indicators or dimensions of the health promoting school approach, and across the models available, there is the SHE concept of HPS, the IUHP1, WHO. I think there are 30 or 40 different models, but the similarity, the one thing they share all is that in one dimension, they also address the learning of health skills, sometimes also called life skills, health-related life skills, also in relation to health behavior, health knowledge, health attitudes, etc. So this is in all these models. And how we described health literacy, I think that health literacy is a perfect complementary element in this dimensions. And since this dimension is meant to be addressed in all these models, addressing health literacy wouldn't require anything in extracurricular work in these models, but could be part of what's already been going on and thereby contributing for sustainability. But in order to have true sustainability, first of all, you have to bring this concept in a mandatory way to schools. And as I said, that here in Germany, we don't have health education. The school nurses exist for 1 or 2 years now only in a model project. the health promoting school approach, in Germany now called Gute Gesunde Schule, is around for 30 years, the Gute Gesunde Schule for 20 years, but it's only model and a model project. It's not mandatory. And also the schools who are interested in that concept take part in it. So I think the first step should be make this kind of, I don't know if you can say make it mandatory, because this, the first objective, the task of schools is to to do education, to increase the educational outcomes, and many schools don't understand themselves to be responsible to increase health outcomes. But the first thing should be make health promotion and prevention a part of what's going on in school. And there are already very good models and examples how you can do it. And once this has been put in motion, if this is in place, then we can see how health literacy adds up on this and how this altogether is or is not sustainable. I hope this.
Yeah, no, I completely agree with you, but maybe I'm allowed to add an idea or a thought. In Austria, we have this state mandate written down in the curricula. Most teachers do not know this, but it's written down if someone is very consciously reading the curricula. And so I think that maybe this is the only thing I do not agree in a tiny little point. We do not need nurses or nutritionists, because we have in the curriculum written down that every teacher, because of the overarching teaching goal, has the right or the occasion or the possibility, whatever, in every compulsory subject to relate some minutes of lessons of the lesson to health literacy and health education. For sure, it depends on the health competence and the health knowledge of the teacher, whether it's the mathematics teacher, the English teacher, whatever. But we have this possibility and no one knows. So we have the chance here to get in, to get to the kids. And this is not put into action. And this is what I mean. We have the knowledge, we have the theories and the models you mentioned before. Maybe I guess it's 25 or 30 different models, but it's theory. It's not put into practice, although we have the occasions. And this to me is a big misery. And maybe we can turn to this point in the future years as SHE research group, whatever. So this is the background.
Yeah, one comment to that, and this is a really good point, because I think that there are some other countries who have the same situation than you have in Austria, that it's mentioned in the school curriculum, and all teachers should be teaching these issues throughout their own school subjects or their main teaching subject. But I think that one of the key issues here is the teacher training, and if health literacy or health education is not part of the teacher training, and this especially among the subject teachers or the primary school teachers, then they don't know about it. They don't learn the competencies, and they are not available of the whole situation, like you said. So in our country, when we have the obligatory school subject, the teacher trainers, to be qualified to be health education subject teachers, they have to do certain amount of university level studies in order to be qualified to be. So we kind of make sure that they have the required competencies, and when it's part of the when it's an obligatory school subject, time is automatically allocated, and it's also, their subject is also graded. So in our case, it's not only health issue, but it's an academic issue, because health education and health literacy then is an academic subject and contributes to academic competence. So health literacy becomes an academic competence. Then it has a different kinds of value than only like a health outcome that is important, but not the main task of the schools, like Håkan said several times, that it's the education, and also Kevin raised that.
Yeah.
So there are kind of different possibilities, but I would put more emphasis on teacher training, definitely. And that is one of the main, challenges in Finland, as well as the primary school teachers should also, all of them should teach health education, but it's not kind of introduced in all the teacher training programs that train primary school teachers.
And not at least in the physician's curriculum in the tertiary level, when you get to study physician, to be a physician or primary care physician, there is no lectures like sports is medicine or food is medicine or like this. So I agree completely.
Yeah.
I think we can take two questions. One is for you, Orkan, and one is for you, Lena. So I will start with one for you, Lena, and you can think about that while I ask Orkan afterwards. So, Lena, oh, I have to find it now. Yeah, it was from Martina. So she's asking how we can make leadership and principals in the school more aware of, health literacy and the work that how to make it sustainable. And so if you can think about this question while Orkan, you answer Anna Maria from Hungary asked earlier, and I know you have a huge experience with this, about different scales or surveys, and I know there are tons of them. But if you were to give so if you are a young researcher, or if this is a new area for you, I mean, where would you start to sort of get an idea if you want to measure health literacy in children? Where would a good place to start? Is that WHO? Are there certain scales that you think are better, or can we share a link with this, or are there references, some of the stuff that you have written together with Lena? Where would you sort of start if you wanted to get an idea of how to measure health literacy?
There is a tool shed by, I think it's Boston University in the US, a homepage. It's called the Health Literacy Tool Shed, and I can later forward the link. This is a database driven by the research community, and all the available health literacy measurement tools are listed there, with lots of psychometric properties, publications, contacts, and what studies they have been used, what age groups are they good for, etc., etc. So this is the first starting point to get just an overview, what's there on the research markets regarding measurement, and where something is missing. Other than that, maybe I can highlight 3 questionnaires, because it's about children, adolescents. And the HBSC study, Lena has just presented some data in her slides about it's the health behavior in school-age children study. There is a health literacy scale by Lena. It's a comprehensive model of health literacy with 5 dimensions, measuring health literacy using 2 questions per dimension. This is one. You can use it in adolescents, for example, different age groups. In HBSC, they have used it in, I think, from 11, 13, 15, 7-year-olds. So a broad range of age groups. Of course, you have to see maybe for the youngers, you have to make some changes, but this is a scale. There is a scale on very young children, school children's health literacy, which is based on the European Health Literacy Survey questionnaire, addressing primary school children, particularly in the fourth grade. Also comprehensive model addressing finding, understanding, evaluating, using information to make decisions in everyday life. This can be used 8 to 11-year-olds. This is what we have done, and colleagues are now translating it and doing their pilot studies. A colleague here in Germany did a survey on life skills across 6 or 7 federal states, Uwe Bittlingmeier from Freiburg. He included that scale and measured the health literacy of, I think, 11 to 14, 15-year-old school children, and it worked there as well. It has proven to be reliable and valid. So this is another scale. And then last but not least, there is a scale by Van der Vaart and Drossard from Belgium. the digital health literacy scale in 7 dimensions, a comprehensive model of digital health literacy, which is based on the understanding that we presented, the understanding of health literacy, but somehow adapted to the digital environment. And this questionnaire has been adapted also here in Germany to be used in school children 15-year-olds by Kevin. So when you visit Kevin's homepage, there is the questionnaire available, but it's in German. But since it is based on a questionnaire from Belgium, there's also an English translation of that questionnaire. So this is how you could start. But
thank you very much, Håkan. And we will try, if you can try to share the link for the toolshed in the chat, that would be wonderful. I don't know, Lena, if you have had time to think of an answer for Martina's question from the chat.
Yeah, about health and principle. Yeah, it's a tricky question because I think the venue or how to influence or how to influence and principles depends on the countries. And I was trying to reflect from the perspective of our country, and I would say that in our case the process would start from the Ministry of Education and ministries, because and in our country, for instance, the national curriculum space is a highly important educational policy paper that kind of influences all the practices that happens in schools, including health and health promotion. And when, in our case, health and health promotion are embedded in our and included in our national school curriculum, and the principals are really kind of, they know the thing, and that's one of the key emphasis areas in our school curriculum, the well-being and health. And so I, like I said, it depends on the country, but I would start from the Ministry of Education, and if they, for instance, kind of make collaboration with healthcare sectors, or if health is a kind of key topic of education sector as well, I think that it would also influence the work of the principals. And I don't think that the money is the key issue. Of course, we certain resources do pay, but it's more like an efforts and ways of organizing the day and the school practices that influence more, perhaps. But that's like a, yeah, but I think that Kevin, Håkan, you have studied principles and school stuff or school leaders or leadership.
yeah, Kevin, I think Kevin is not here in the room.
Okay.
But you're totally right. Kevin did a study here in Germany on the role of school principals, and he found out that they have the most critical role to play, and this is also influenced by their health literacy. So the degree of the principals' health literacy and engagement with health promotion was also a predictor of activities undertaken in this school or setting. So first, if you want to do something in relation to health in the schools, this is the first contact point you have to approach. And if you have this person on your team, the principal, then it is much more easier, and he will help you do your action in schools, convince the others to take part in it. And this will also reflect on the rest of the players in the setting. And we did a study on mental health literacy of teachers, and we also asked about the principals, and there we found rather similar results where the available school health promotion and prevention strategies were dependent on the principal's attitudes, his thinking about health. And if she was interested in that topic and pursued it, there were more these strategies available, and then teachers were also more engaging with health promotion and prevention. So we see they have a fundamental role to play, the principals, in both terms, regarding action to be provided in relation to school health promotion and also their own health literacy.
Yeah. Thank you. Oh, sorry,
Just
Lena, go ahead.
could I ask to a couple of questions that has been raised in the chat?
I think we have to be pretty quick now,
Okay.
because people are starting to leave and we need a few things to do. So I think it would be better that I know we have the second keynote tomorrow at 1 o'clock. So please, those of you that are now a part of the academy, we really hope to see you again tomorrow. Those of us that are in the academy, we will have time to discuss with Lena and Håkan in the groups and in sessions tomorrow. Before we leave, because there's a few things, please, I will link in the chat for the newsletter for the SHE network. So if you don't receive the newsletter now, this is a good way to keep informed. And I need, please, everyone to answer a short evaluation, because this is something we have to do. Of course, we also would like to know about the reception of the things that we do, but we need an evaluation for the European Commission. So these things are funded by the network, is funded by the European Commission. So the second link, I will just So the second link is, sorry, Ulla's running. Yes. So the second link is the link for the evaluation. So please, we would like everyone that is in the SHE Academy to stay in this room, and we will just do a few things in a few minutes. It will only take a few minutes. Those that are only here for the keynote session, thank you for joining us. It was wonderful to have you. We were 70 people in total. So that is really, really good, I think. And thank you for your questions and your participation. Please answer the evaluation before you leave. And then you leave the room, and we really hope to see you again tomorrow at 1 o'clock. And those of you that are in the SHE Academy, also please answer the evaluation and then just stay in this room, and we will finish up here in just a few minutes. So maybe just take a few minutes to answer the questionnaire, and and then we will finish up in here. Okay, but some. Okay, so we are 37 people left. I think we are still a few. Almut, you came back?
Sorry, was a mistake.
Yep.
So is the link still in the chat room for the evaluation?
Yes, I can, or I can, I think maybe when you leave and come back, you cannot go back in up, and so I can repost it here.
Okay, thank you.
Jasper,
Okay, is there a problem with the survey, or?
Well, there's a question that is about tomorrow's keynote speaker. Should we just answer today?
Yes, please do.
Okay, or we skip that one and we go to the other questions?
Yes.
Okay.
Yeah, so you answer the one for today and then just skip the other one.
I don't know what's the problem, but I don't have it in the chat. Can you try it again, please? I don't know what.
Yeah, just hang on. Lena is just mentioning to me. Yes.